Hi, I'm Ruth O'Regan, Chair of Medicine at the University of Rochester. So overall, we've used genomics extensively in hormone receptor positive breast cancer to determine whether patients need chemotherapy or not. So there's obviously a number of genomic assays out there. The ones that are most commonly used are the 21 gene recurrence score, the 70 gene signature. However, with radiation, I think at this point, genomics have not been used as much in this setting. Now, there is some data from some of the original data with the 21 gene recurrence score indicating that patients who have low recurrence scores do not only have a low distant recurrence rate, but also a low local recurrence rate. So it actually makes a lot of sense to think about using a genomic assay like the 21 gene recurrence score to determine whether patients need chemotherapy in this setting or not. I mean, when you think about it, radiation kind of works somewhat similarly to chemotherapy, and you would expect the cancers that have a high proliferative rate, which obviously you would expect they would have a high recurrence score. We know that where they're the cancers that are likely to benefit from chemotherapy, and I think you can extrapolate from that they're also the ones that will be likely to benefit from radiation therapy. So conversely, if you have a low proliferative cancer that we have shown now in TAILORx and in the responder study in postmenopausal patients, that these patients really don't get any benefit from chemotherapy. The question is, how much benefit do they really get from radiation? So this has been evaluated in some clinical trials right now, where basically looking at patients who have these low genomically risk cancers and determining in those patients whether you can de-escalate radiation the same way we've been able to de-escalate chemotherapy. So I'm pretty hopeful that we will reach that point in the next several years, where we'll be able to say to a patient, you know what, you don't need chemotherapy and you also don't need radiation. You're going to do fine without it. Of course, providing, of course, they get endocrine therapy, because we know that endocrine therapy not only prevents distant recurrences, but also prevents local recurrences as well.